Elizabeth. I suffered a severe facial injury, and it was traumatic in that it left me with a fractured eye socket, multiple facial fractures, and a broken nose, and a very large scar underneath my left eye. I was a victim of domestic violence. I had heard about Dr. Gross. In fact, I heard about him through a neighbor who herself had a skin cancer removed from her face, and it was a severe one. Left a hole in her face, literally. And Dr. Gross did major scar revision on her, and her results were absolutely amazing. So when I saw those results, and myself being in need of a lot of help, I sought Dr. Gross out, and I'm very glad that I did.
Well, when I first met Elizabeth, it was after she had recovered from an initial injury. It had been about maybe 3 or 4 months, possibly a little longer, after she had been hospitalized and treated for initial trauma. The first thing I really noticed when I met Elizabeth, number one, she had a great attitude, and that is so critical to recovery, to have a good emotional base to work from. But also she had some noticeable deformities on her eye socket, her nose, and she had some scarring that was really kind of not reflective of who she saw in the mirror when she looked at herself. She made that very clear to me, but I think I kind of dialed into it very quickly. Also, the areas that were bothering her, and we went through the consultation process really step by step. She was right on target with everything that she wanted to have improved and corrected. The reconstructive surgery that she needed to have done, rhinoplasty surgery, reconstruction of her orbital rim, scar revision, laser therapy, all the things she needed help with. We put those on the video imager for her and showed her how she could look. And I think we envisioned that really to a T. Maybe we even went beyond what we expected for you, because the results that she has now are really just outstanding. And she looks very balanced, she's back in proportion. She has the symmetry restored to her face that I had hoped for. And really, I think the connection was a very heartfelt one, because she really wanted to get the improvement and get back to where she started from.
And as I had stated earlier, Dr. Gross and I made an immediate connection, and I felt he was reading my mind, actually. It was that amazing. And as a result, I've definitely moved on, and like I said, after that first initial consultation, which is all it took for me, I couldn't wait to get into surgery. I was that excited to make those improvements, and I felt incredibly confident and trusting of Dr. Gross that he would be able to deliver it, and he has more than done that for me.
It's something that a lot of people deal with, but they don't really know where the resources are. And through our academy, the face-to-face program with the American Academy of Facial Plastic and Reconstructive Surgery, we offer our services pro bono to victims of domestic violence as a way of giving back to the community. And it's something that I really feel good about, and I feel like we're really making a difference in our community and in society to be able to help people like you.
Oh, thank you. Well, having been a recipient of that, it's been a life changer, and for that I'm incredibly and deeply grateful.